Alright guys, this is our last video for Unit 3. We're going to start back talking about mycology or fungi in the medical laboratory. Most testing for fungal organisms takes place in larger laboratories, but there are two common fungal infections that can be quickly assessed in the clinic or physician office laboratory. Candida is the first one, and there are several species that cause different yeast infections within the body. They're examined microscopically for the characteristics of budding yeast forms. There are also dermatophytes, which causes infections on the hair, skin, and nails. You'll see a picture here. There's a fungus on the skin of the scalp here, and it's diagnosed using a wood's lamp. Tinea capitis, or the dermatophyte, is what this is called here. Right. Special laboratory test, getting into the nitty-gritty here. So one of our special lab tests would be a pregnancy test. This is going to assess the presence of HCG. This is human chorionic gonadotropin. Sometimes we do pregnancy tests to prescribe birth control pills. The physician will need to make sure the person or the woman is not pregnant prior to prescribing birth control pills. Certain radiographic studies, they won't do an x-ray on certain body areas if you aren't sure if you're pregnant or not. And then certain antibiotics, you have to make sure that you're not pregnant, so they'll run these pregnancy tests. You can assess pregnancy or the presence of HCG through blood and also through urine. Infectious mononucleosis, or also known as mono, very common at your guys' ages, also known as the kissing disease. It's a contagious disease of the herpes family, and it has really vague clinical symptoms that actually can last for months. Fatigue, swollen lymph nodes, just overall generalized not feeling well, sore throat. People that get mono actually are sick for a pretty long time, and it can wipe them out for sure. PKU. PKU is a test that it's an inherited condition in which a baby does not have the enzymes that it needs to metabolize a certain amino acid. And so these amino acids actually build up in the body because their body's not able to digest it or to metabolize it. And it causes irreversible disability. They lose muscle coordination, and they have other effects on the baby. So they have to check for PKU shortly after the baby is born. It's called a Guthrie test, and it's usually about 3 to 4 days after the baby's been born. It doesn't matter if they're on breast milk or formula, but they get tested to make sure that they're actually breaking down those enzymes, because if not, they'll have to change up their diet and give them special things to help them metabolize this amino acid so it doesn't build up in their system. Cholesterol testing. This excessive cholesterol is linked to coronary artery disease. It's what builds up that plaque in our arteries. 240 milligrams per deciliter or greater is considered high risk for heart disease. And anywhere between 200 and 239 is borderline for high cholesterol. So just kind of noting that. And then fecal occult blood test. We will actually practice assessing fecal occult blood tests in class, and it's a screening tool to see if there's actually blood in a stool specimen. And the patient may collect the stool specimen at home. Obviously, most people can't have a bowel movement on demand, so the patient will actually bring the stool specimen into the clinic with them, and then the specimen is processed and analyzed. Just to go back, make sure that you watch all of these videos. It shows you about these tests, how they're performed, and it's pretty interesting stuff. All right, the last thing we're going to talk about is tuberculosis. So infectious TB is caused by a small rod-shaped bacterium, Mycobacterium tuberculosis. It's highly contagious, and if you'll remember our precautions, it's an airborne precautions disease. It's diagnosed with either an active or inactive TB. We screen individuals for TB or tuberculosis using a Mantox test. And most of you have probably had this if you've had a job where you have to work with individuals or work in healthcare. But if you haven't, you're learning about it now. So what happens is that they actually put a little bit of I'm going to move on. They put a little bit of a purified protein derivative, so a little bit of that underneath the skin. It's injected, and I went to this slide so you can see what I'm talking about. Using a small syringe, it's just implanted right underneath the skin. It's called an intradermal injection, and the patient's instructed to come back within 48 to 72 hours to be examined. And the site, if the person is positive, is going to be pretty ugly. It's going to be pretty angry at us. Now, if you're negative and you've never been exposed to tuberculosis, that area is going to be pretty, it might even be completely gone, or it's going to be slightly visible, if at all. But if you're positive and have been exposed to tuberculosis, then it's going to look pretty angry. And then to know if it's actually an active or inactive case, then they'll do a chest x-ray following that positive Mantox test. It's our role as the MA to both inject the PPD, the purified protein derivative, which we will go into more detail in our later lectures, but also to assess the site within that 48, 72 hour window for the induration. So that site, we want to assess it and then report those findings to the provider. So it's a really important part of the medical assistant's job is actually giving tuberculosis screenings, or the Mantox test as it's also known as. Alrighty guys, so that concludes Unit 3. Be sure to read over those chapters. Remember they're chapter 37, 38, 40 to 43. Really hone in the things that I mentioned as you're reading through. And once you feel comfortable with all of this material, go ahead and take your Unit 3 quiz.